Hi, my name is Brigitte Ordóñez and my topic is Crohn disease complication. The definition: Crohn disease is a type of inflammatory bowel disease. It causes inflammation of your digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. Inflammation caused by Crohn's disease can involve different areas of digestive tract in different people. This inflammation often spreads into the deeper layer of the bowel.
What is Crohn's disease? Crohn's disease is a chronic condition characterized by inflammation in the gastrointestinal or GI tract, which is also known as the digestive tract. Since Crohn's disease is a chronic illness, it is persistent and will be present throughout a patient's life. However, patients and physicians can work together to manage the symptoms of this disease. The GI tract includes the mouth, esophagus, stomach, small intestine, large intestine, and anal region. Crohn's disease can affect any part of the GI tract, but the most common location is the last part of the small intestine, which is called the ileum, and the first portion of the colon, which is also referred to as the large intestine. Current thinking is that Crohn's disease is a genetic disease caused by abnormal regulation of the immune system. The GI tract is frequently confronted with bacteria from our diet and environment. Many factors can contribute to a person's risk of having Crohn's disease, but most can be thought of in three categories: genetic predisposition, environmental factors, and a dysregulated immune response in the GI tract, which causes inflammation. Environmental factors that may contribute to Crohn's disease include infections, smoking, and taking antibiotics or anti-inflammatory drugs known as nonsteroidal anti-inflammatory drugs, or NSAIDs. One way that the body can protect against potential bacterial threats is with inflammation. We are familiar with how inflammation looks on the outside of the body, for example, when you have a scrape or a cut. That scrape or cut becomes red and inflamed as a result of the immune system trying to get rid of any bacteria and viruses that are in the wound. After a few days, when the immune system has finished its job, it turns off, so the redness and inflammation disappear. In Crohn's disease, inflammation, ulcers, appear within the GI tract, and the immune system works to combat the bacteria and viruses in the same way as with a cut on the surface of the skin. However, the difference is that the immune system is not able to turn itself off after it has gotten rid of the bacteria or virus, so the ulcers remain until they are treated with medicine or surgery. This chronic inflammation is what causes the symptoms of Crohn's disease. The symptoms of Crohn's disease vary depending on where the disease is located and its severity. This means that every patient with Crohn's disease experiences the disease differently. Most patients with Crohn's disease have abdominal pain and diarrhea. Other symptoms related to the GI tract can include abdominal tenderness, loss of appetite, weight loss, fever, fatigue, rectal bleeding, anal skin tags, and ulcers. In children, Crohn's disease may result in stunted growth and a failure to thrive, even if GI symptoms are not present. In addition to symptoms involving the GI tract, Crohn's disease can affect other parts of the body. Symptoms outside of the GI tract can include joint pain, liver inflammation, osteoporosis, skin problems, eye problems, mouth ulcers, and anemia. Patients with Crohn's disease should expect to lead normal lives in consultation with their healthcare providers. The goal of the healthcare provider is to help people manage Crohn's disease, rather than having the disease manage them.
way I explain Crohn's disease to children is their immune system is overstimulated and it seems to be attacking their own intestine.
So you develop an inflammatory response that gives symptoms, and those symptoms are typically why the child is coming in for evaluation, be it pain or bleeding or abnormal stooling or poor growth.
What people need to realize is that this disease is not going away right now. We don't understand why it happens specifically. We don't have all the answers as to how we can make it better, and we don't have the answers as to what the cure might be.
Well, there's a lot of really smart people that are out there doing a lot of research. Our goal is that these children have a normal life living with a chronic disease.
Application in medicine. Complication of Crohn's disease may or may not be related to the inflammation within the intestine. Intestinal complications of Crohn's disease include obstruction and perforation of the small intestine or colon, abscesses, collection of pus, fistula, and intestinal bleeding, massive distension or dilatation of the colon, megacolon, and rupture perforation of the intestine are potentially life-threatening complications, but may require surgery, but fortunately, these two complications are rare. Recent data suggests that there is an increased risk of cancer of the small intestine and colon in patients with long-standing Crohn's disease, but studies are conflicting.
When I first met Dr. Lazarev, I was at probably my lowest point.
She was, I think, 96 pounds, and they had gotten her up to 96 pounds.
At that point, I was maybe just turned 30. The Crohn's disease had just taken over my body.
So it was really hard. I mean, there were so many things that I couldn't eat and had to avoid.
I wasn't absorbing nutrients from my food, and anything that I was able to tolerate food-wise would literally go straight through me.
Crohn's is a chronic inflammatory condition that can affect any part of the gastrointestinal tract. It really can be very devastating for patients, and many of these patients are very young.
Dr. Lazarev did some tests, had to give me some pretty hard results.
He suggested an ileostomy because then there were no medicines on the market to help her. They had tried basically all of them.
There's not quite a lot of enteroids here, right? Not typically.
Many of our patients, unfortunately do have surgical issues as well. So it means we work very closely with a number of specialties. Here at Hopkins, we have a multidisciplinary inflammatory bowel disease center. And almost all of the clinicians are also very steeped in research because we're always trying to move the needle. We are at the forefront in terms of providing latest and greatest therapies for patients, some of which are investigational, which hold great promise for our patients.
You have some nice ones up.
From the time that I had my ileostomy surgery, everyone at Hopkins was great. Every aspect of my health was improving.
Lazarev told us about a medicine that was on the market for clinical trials and everything. We became hopeful, and we started to ask questions like, could we have children on this and things like that, and he told us yes.
Started me on Entyvio, which is an infusion that I get every 8 weeks. It has done wonders. I actually had a scope test done shortly after starting the new medicine. I told Dr. Lazarev, I said, those aren't my pictures. Like, it's too healthy. So I've been on that medicine ever since. It actually allowed me to get pregnant. We have a little baby girl. She'll actually be 3 on Tuesday. Really, it was fortunate that I had the care at Hopkins because of my GI concerns and actually delivered at Hopkins.
I think the continuity of care is really important. I think knowing a patient for upwards of almost a decade, you really grow with them.
Some of the best doctors in the world work at Hopkins, and we truly see that when we go there. When Nobody else had any answers. They had answers.
It was incredible because of the help that I had, the surgery, the medicine, and just the ongoing care. I've never been as healthy as I am now. It really gave me my life back.
Pros and cons. Crohn's disease causes inflammation of the digestive system, also called the gastrointestinal tract. With Crohn's disease, treatment goals are twofold: to relieve symptoms and to prevent future flare-ups. In order to achieve and maintain remission, it's important to control ongoing inflammation. Your doctor may prescribe corticoids to help deal with acute flare-ups. Corticosteroids, sometimes referred to simply as steroids, are a group of drugs that help reduce inflammation in your body. Corticosteroids are similar to cortisol, a hormone that is naturally produced by your body's adrenal glands. Cortisol helps you fight stress associated with illness and injury. Many patients will experience an improvement in symptoms within days of starting this medicine.
Crohn disease. The quick facts. What is Crohn disease? Crohn disease is long-term inflammation of your intestines. It usually affects the small intestine, but it can affect the large intestine or both the small and large intestines. The most common symptoms of Crohn disease include diarrhea, which is sometimes bloody, crampy belly pain, fever, no appetite, and weight loss. If a flare-up is severe, you may have severe, constant belly pain from a pocket of pus around your intestines, or heavy vomiting from a blockage in your intestines. Doctors don't know what causes Crohn disease, but the risk is increased if you have people in your family with the disease, are Jewish and your family comes from Eastern Europe, smoke, or are a woman and take birth control pills. Doctors do tests depending on your symptoms and how suddenly they come on. If you have sudden severe belly pain, they will do a CT scan or an MRI of your belly. If you have off and on belly pain for a while, they will sometimes do x-rays or a CT scan of your belly. If you have diarrhea, they will look in your colon with colonoscopy. Doctors will also do blood tests. Blood tests can't diagnose Crohn disease, but can tell if you have certain complications. While there is no cure for Crohn disease, treatments can help reduce the inflammation and relieve symptoms. Medicines may help stop diarrhea and belly pain, lessen inflammation in your intestine, or change the way your immune system works. Doctors will also ask you to quit smoking, drink plenty of fluids, take nutrients such as iron, calcium, and vitamin D supplements, avoid nuts and raw fruits and vegetables when you have a flare-up, try a dairy-free diet to see if it eases symptoms, not take certain medicines that can cause a flare-up, such as painkillers called NSAIDs, and to avoid stress. Most people with Crohn disease need surgery at some point. In this surgery, doctors remove part of your intestine, which helps with symptoms. Half of the people who have surgery need a second surgery later.
Issue applied in Ecuador. We seek to determine the epidemiology and behavior of IBD in the Ecuadorian population. Descriptive observational study using the clinical record of patient diagnostic with IBD from the three referral centers for IBD of Ecuadorian Social Insurance from 1919 to 2018. Result: this study included a total of 206 patients diagnosed with IBD. Of these, 148 with ulcerative colitis and 58 with Crohn disease. The average age of diagnosis for Crohn disease was 42 years. The average time for onset symptom to the diagnosis was 12.6 months for Crohn disease. The most frequent symptom in chronic diarrhea in Crohn disease is 37.2%. The most frequent location in Crohn disease was ileocolonic, is 36%. The predominant extra-digestive manifestation for was articular Crohn disease, is 70%.
Hi there, I'm Dr. Andrew Dixon from radiopedia.org, and today we're going to take a look at the comb sign seen in active Crohn's disease. It can be seen on both CT and MRI, but today we're just going to look with CT. On this coronal image, we're just going to zoom into the important section here and show these distended mesenteric veins extending out to an inflamed segment of small bowel, like the teeth of a comb. On the axial plane here, we can see some prominent vessels extending down to this very inflamed segment of terminal ileum. I'll get my laser pointer out and show you in more detail. The reason why the vessels stand out is not just because they are distended, but also because there is fibrofatty proliferation around them. We can have a look here and see how thickened that segment of bowel is due to the inflammation, and comparing that to a normal segment of bowel next to it. So that's the comb sign, vessels dilated in active Crohn's disease. You can find out more on the Radiopedia website.
The conclusion. In conclusion, Crohn's disease is a lifelong condition where parts of the digestive system become inflamed. Crohn's disease can cause intestinal obstruction, fistula, abscess, ulcer, malnutrition, and other problems. There is no cure for Crohn's disease, so to prevent patients from developing and worse SNR, it's important to choose a correct treatment to decrease the inflammation of the intestine, relieve symptoms, and avoid complications. Thank you.